On an average, every Indian goes through treatment once in their lifetime. So if that insurance cannot help you in that one instance, then it's a big deal when it comes to people knowing their terms and conditions of their policies or trying to solve for that.
Hey folks, welcome to Cheque Portfolio Shots. My name is Tejas, and this is a series where we speak to founders of our portfolio companies so that you get to know their team, understand what they are building, and the problem they are trying to solve. If you like the content that we've been putting out, do like, share, and subscribe so that we get to reach more founders and startup enthusiasts like you. Today's very special guest is Khet, co founder of Claimbuddy. Claimbuddy is a MediClaim support company that acts as one-stop solutions for claim assistance for patients and hospitals. They are building an ecosystem to ensure hassle-free insurance claims by leveraging technology and a set of simple yet powerful processes and operations. I had a really interesting conversation with Khet, and it was really great to learn about their culture and their plans for the future. Stick around till the end of the episode to learn more. Hey Khet, how are you doing today? It's great to have you here.
Hey, hi Tejas, I'm doing great. How are you?
I am good too. So let's get started, Kate. So my first question for you today is that what is the problem you're trying to solve as a startup founder, as a founder of Claimbuddy, and what is the solution to that particular problem?
Right. Definitely. I'll come to the problem part. Before that, I'll just try to give you a little background on how we face that problem. When did we realize that it's an actual problem? So, before Claimbuddy or before my MBA, we were working in an early stage healthcare venture. And that's when we were working with patients, hospitals, doctors. We realized that, insurance claim is a major problem. And that's when, we saw the problem firsthand. And when we did some research around it, we realized that, claiming insurance, especially health insurance in India is a big pain. We have seen like patients spending additional nights just because their approval didn't come in time. Right? Examples like doctor gave an approval say in the morning, but now patient is there admitted, still waiting for their approval to come in. So that was one of the first instance when we realized, okay, this is a real problem. And then we did some research around the data and visited few hospitals, met few patients firsthand, and just to understand that claim processing in India is actually a big problem. Although we are pushing towards cashless claim processing, reimbursement claim processing, but still there are a lot of gaps which are there, and there's nobody really helping hospitals and patients to solve for these issues. That's when we thought, okay, this sounds like a real problem, a major problem in India, and healthcare is something we were always inclined to. That's how we started realizing that we should kickstart something like Claimbuddy, and and I met my co-founder Ajit in my previous organization itself, and he's also somebody who comes with an insurance background. So the idea was to solve for this one piece in and out, end to end. So that was a problem. And talking about the solution part, Tejas, I mean, overall, we had an idea that okay, this is an operations heavy problem to be solved, and there has to be some tech also involved in it, just to enable those processes easier. So we started completely zero tech, zero product, just to me and Ajit would sit at hospitals to process those claims ourselves, just to ensure that we understand it in and out before we even build a product or get into the tech part of it. So over the period, we have brought in a lot of tech solutions and financing solutions to solve for this particular claim. And the idea remains the same, that it should be hassle free. The patient should be most comfortable. The hospital should also get some domain expertise in terms of how to process those claims right. So we have our tools, we have our softwares, which are currently being used by our hospital partners, which further helps the patients to have a easier claim experience.
Amazing, Kate, and I know that problem is real from personal experience. Awesome. So, moving on, my second question for you is what progress have you had so far?
See, in terms of progress, right? If I don't have to quantify it, then we have solved these problems for a lot of patients in terms of their experience. And just to put some numbers to it, we have processed roughly more than 120 CR worth of claims so far. We have touched, a monthly claim processing of 10 plus CR of amounts. That is roughly 1,000 to 1,500 patients a month, and so that has been the progress. We started from a small team of five, working out of a rented flat, and today in terms of our team count, we are touching almost 90 90 employees across 7 cities now. And the idea is to even scale faster and touch base with more cities and process more claims. And also, in terms of our hospital counts, we have 150 partner hospitals with us across these cities.
That is amazing, Kate. So, you've already mentioned how you met your co founder. So, can you tell me what is the company culture like at Claimbuddy?
Right. See, talk about company culture. See, we both are first-time founders. We all, of course, we do have some startup experience of working in early stage startups before kickstarting ClaimBuddy. So culture, we are trying to make it as basic as possible. We are not putting any sort of hierarchy as of now. And Personally talking. I'm managing, me and Ajit. We have a team of 90 people, 90, but we never felt like it's a employee employer relation. It's a very cool culture in those terms. We don't have any sort of restrictions in terms of what you have to wear, or what should be the dress codes of the worlds, etc. But then again, at the time, we are very much we stick to basic principles of hustling hard, and we the idea is to finish the tasks. Doesn't really matter how much time whoever is taking. That is where our culture fits in. Of course, we are at a stage where we recently closed our pre-series A kind of a round of investment. So now we are trying to push for the hiring part as well, and make it a larger team, along with a lot of improvements in our tech solutions and financing solutions. So we are at that stage when we are going through a change in terms of the entire or the hierarchy or the organizational structure. So yeah, in terms of culture, average age of our organization, I would like to mention, is 27. So you can imagine, the young team, hustling day in day out, solving for these issues, who actually care for these problems. And that is one of our major criteria. If somebody is really passionate or has that sense of empathy towards these patients in hospitals, where where they understand, they match with our vision of solving for these healthcare problems in India. So that's where we touch base our culture with, but again, even improving that day in day out.
That's awesome, Kate. My last question for you today is that every startup founder has that one real moment in their lives where they just stand still and think that they're building something cool. And I'm sure you've had that
Right.
moment as well. So, can you tell me about that particular moment?
Yeah, I mean, see, for us, especially for me, I met a patient, right? He was a defense retired person, like some 70 years of age, and he he used to go through these regular medical treatments for his disease, right? And uh, and there was a point of time when insurance companies rejected his claims outrightly, since he had filed those himself, and these were reimbursement claims. So I got a message from him on LinkedIn, a detailed message saying that this is who I am. and I'm the sole earner at this age, and staying here, these are the problems, and now this much is my bill amount. I have an insurance, I am paying premium time to time every year, but still not able to get the claim. So I personally, assisted him along with our team to solve for it, and eventually he got that money, right? And the sum was close to 10 lakh rupees. So for him, it was a big deal. So that's when we realized that, okay, for patients who are paying these premiums time to time every year, still not able to claim when it comes to their treatments. On an average, every Indian goes through treatment once in their lifetime. So if that insurance cannot help you in that one instance, then it's a big deal when it comes to people knowing their terms and conditions of their policies or trying to solve for that. So that's when we realized, okay, if we have solved for this one patient, it definitely means that whatever we are solving for is does make sense. It does have a bigger solution. It that does have a bigger, I would call it a bigger mission when it comes to solving for health insurance claims, irrespective of the business numbers, irrespective of you know what revenue you make or all those things. Keeping everything aside, I think the problem here is something very real. And in India, especially when post COVID, the health insurance has surged. Now people are buying policies. It becomes more important for them to be able to process those claims when it comes to usage of those policies.
Awesome, Kate. So it was really nice talking to you today, and very
Yep.
good. And thank you for being here today, Kate. It was I really enjoyed talking
Thanks.
to you.
Thanks a lot, Tejas, for taking out time and having this conversation as well.